I want to speak briefly about the use of the eRecord for scheduling and reporting. When you log in, you will find on the home page a scheduling link. You can use that link, or you can use the link from the Go links, the top left-hand corner, where there's a drop-down to get to your schedule. So I'm going to click on scheduling, and that brings me to my schedule for today. This is the weekly schedule for Jeffrey Gray. Now, if I want to make an appointment, I simply click on a time, and I'm going to click on 1:30, and I'm going to make it a 9:08:47. I click Save. I click on Attendees. I put in a first couple of letters of the last name to find the attendee, and I'm going to make an appointment for Dick Tracy. And I am done. So if I click the X here, I will go back to the schedule, and you will see that Dick Tracy is listed. Now, if Dick Tracy were being seen on a regular basis, I could click on the tab Recurrence, and I could add a recurrence. Now, we've been looking at my schedule. We can also set up views for all staff. So if I click on here, all staff, I can see that the appointments for all of the clinicians in the practice are listed here. Note also on the left-hand side that you can quickly move between weeks and months to find a time for a patient. Views can be edited. So I'm going to click on a view, and I'm going to click on my schedule, and I'm going to click on Edit View. And I can make the default appointment whatever I want, 30 minutes. I can make the grid pretty much whatever I want, between 5 and 60 minutes. And I can choose whether to share my view with others or not. I'm going to share it. Now, to set up appointment types in the scheduler, you click on the link Appointment Types. And this will bring you to an appointment types page. So if I wanted to add a new appointment type, I would click on it. I would give the appointment type a name and say it's therapy 30 minutes. And it's an individual appointment. And I'm going to use Clinician Progress Note R. You need to indicate that. And then I'm going to scroll down and find Psychotherapy 30 minutes. I'm going to click on that, and I am done. I click Save. Also, by the way, you can put in the color. I'll make it blue. You click Save. So I've added that particular appointment type. Now I'm going to go back to my schedule, and I'm going to make an appointment at 1:30. And this time I'm going to choose Therapy 30 minutes, the appointment type I just entered. I'm going to hit Save. I'm going to choose an attendee. I click on Attendees, and I'm going to put in a letter, first letter of a last name. So I'm going to make an appointment for Absalon. And there it is. Some users want to generate a checkout receipt when a patient checks in. So when they check in, you can click on the appointment. You can click on Attendees and then click on Completed. And once you do that, it will post a payment, and it will create a draft progress note for the patient. I'm going to click on Payments Receipt, and then I'm going to go to Documents, and you're going to see that there is a progress note for 1/1/2013, and that progress note is in draft status. However, the service status is completed. What that means is when I checked in the patient, I essentially posted a charge to his account. So if I go to Accounting, and I go to New Accounting, and I go to Today, you will see that on 1/1/2013 there is a 90847 and a charge that's been posted, although the progress note has not been completed. A couple of other features of the scheduler. There is a master appointment list. If I click on this link, Appointment Master List, it'll give me a list of all the patients I'm seeing that day, their telephone numbers, any notes I have on them, the balance, and whether they have a copay. Another nice feature of the scheduler is that you can set it up so that it sends out email reminders to the patient the day before the appointment. I just clicked on administration here, and I'm clicking on settings here, and I click on alerts, and I have checked send email alerts to patients the day before the appointment. Patients can always opt out of that. Now let me say a few things about reports. The eRecord has an extensive library of reports. To get to reports, you go to the Go links, you click on administration, and you click on this link called Jobs. And this will take you to a page which has a link called Create New Job. If I click on Create New Job, you will see tabs across the top of different kinds of reports: accounting reports, assessment reports, claims reports, and then there will be a description of those reports. So here's an aging report. This is a report that will tell you who has an outstanding balance 30, 60, 90 days out. We have an allocated payments report. That's a report that details how much you made for a particular time frame, last week, last month. And it will show you both the grand total of what your professional service revenue was, as well as the source of the payment, whether it's from the insurance company or from the patient. Clinical groups will oftentimes use this report to pay their clinicians. I'm not going to go through all the reports because they are extensive. We have an authorization report, which will tell you all authorizations that are running out. We have a claims report, which will tell you any aging claims that have not been satisfied, and so on. For those of you who send out statements, there is a statements alert job report, which will send out a blast email to all patients with a non-zero balance with a link to the patient portal, which will enable the patient to access their statement without having to send out paper statements. Now let me speak for a moment about the patient portal. Patient portal is a portal whereby the patient can log in, set up their own account, fill out clinical forms, administrative forms like consent for treatment, pay online, and do other kinds of things. I'm not going to spend much time on this. I am going to log in as a patient, and I put in my user ID and password. It brings me to the patient portal. If I go to documents, I can get a list of the documents that I'm supposed to fill out. For instance, patient-clinician agreement, new patient information, which would be the demographic and insurance information, the PHQ-9, for instance, an adult self-report document, anything you want clinicians to fill out, clients to fill out before they come in. Let's take a look at an adult self-report form. Here they can list their chief concern, their present relationships, their past psychological, psychiatric treatment, their symptoms, the issues that they're seeking treatment for now, substance use history, and so forth. As I mentioned, clients can also access their account statements by clicking on account statements, and they can click on the statement, they can print it out, they can even pay online. Finally, if you want, patients can use the messaging system to send asynchronous secure messages to their clinician. The patient portal is set up by going to administration, going to documents, going to patient documents, and deciding which patient documents you want your patients to fill out. You can add documents by clicking on Add Documents, and there are a great many documents that can be added. This concludes a review of scheduling, reporting, and the patient portal. Thank you for your time.